Breast implants have been safely in use around the world for more than 50 years. Most women with breast implants are satisfied with their results, and their plastic surgeons as well. Recently, however, two high-profile issues have prompted increased concern. Breast implant-associated anaplastic large cell lymphoma, or commonly known as ALCL, and breast implant illness. ALCL is an uncommon and treatable type of T-cell lymphoma that can develop infrequently around breast implants. Breast implant illness is a name given by some patients to an array of symptoms and signs. To better understand the nature of the increasing concerns of both of these, a team of Canadian plastic surgeon researchers surveyed over 60 women in ALCL advocacy groups on Facebook and used a rigorous qualitative analysis to unpack the results. They learned that the women's concerns all center around 5 desires: improved communication around possible risks before surgery, that's reasonable, information as soon as it's available. Number 2, sincere listening to their concerns. Number 3, acknowledgement of the psychosocial and physical impact. Number 4, clarification of implant-related problems and their treatment. And number 5 is improved processes for monitoring and treating patients with these identified problems. The researchers analyzed these themes in the context of the 5 domains of trust. Then they proposed an 8-point plan to help restore and strengthen the patient-physician relationship regarding breast implants. As researchers around the globe study safety, efficacy, and outcomes of patients with breast implants, qualitative explorations like this paper give patients and their plastic surgeons a great framework to expand communication and grow trust. If you're interested in learning more about the potential risks and benefits of breast implants, please contact a board-certified plastic surgeon today.